What is tuberculosis? Tuberculosis is an infectious disease that can cause infection in your lungs or other tissues. It commonly affects your lungs, but it can also affect other organs like your spine, brain, or kidneys. The word tuberculosis comes from a Latin word for nodule, or something that sticks out. Tuberculosis is also known as TB. Not everyone who becomes infected with TB gets sick, but if you do get sick, you need to be treated. If you're infected with the bacterium, but don't have symptoms, you have inactive tuberculosis or latent tuberculosis infection, also called latent TB. It may seem like TB has gone away, but it's dormant, sleeping, inside your body. If you're infected, develop symptoms and are contagious, you have active tuberculosis or tuberculosis disease. How common is tuberculosis? About 10 million people became ill with TB throughout the world, and about 1.5 million people died from the disease in 2020. TB was once the leading cause of death in the US, but the number of cases fell rapidly in the 1940s and 1950s after researchers found treatments. Statistics show that there were 7,860 tuberculosis cases reported in the US in 2021. The national incidence rate is 2.4 cases per 100,000 people. What causes tuberculosis? TB is caused by the bacterium Mycobacterium tuberculosis. The germs are spread through the air and usually infect the lungs, but can also infect other parts of the body. Although TB is infectious, it doesn't spread easily. You usually have to spend a lot of time in contact with someone who is contagious in order to catch it. How is tuberculosis spread? TB can be spread when a person with active TB disease releases germs into the air through coughing, sneezing, talking, singing, or even laughing. Only people with active pulmonary infection are contagious. Most people who breathe in TB bacteria are able to fight the bacteria and stop it from growing. The bacterium becomes inactive in these individuals, causing a latent TB infection. As many as 13 million people in the US have latent TB. Although the bacteria are inactive, they still remain alive in the body and can become active later. Some people can have a latent TB infection for a lifetime, without it ever becoming active and developing into TB disease. However, TB can become active if your immune system becomes weakened and cannot stop the bacteria from growing. This is when the latent TB infection becomes active TB. Many researchers are working on treatments to stop this from happening. What are the signs and symptoms of tuberculosis? People with inactive TB do not exhibit symptoms. However, they may have a positive skin reaction test or blood test. Those with active TB can show any of the following symptoms: bad cough, lasting longer than 2 weeks, pain in your chest, coughing up blood or sputum, mucus, fatigue or weakness, loss of appetite, weight loss, chills, fever, night sweats. How is tuberculosis treated? TB infection and disease is treated with these drugs: isoniazid, HYZYD, rifampin, Rifadin, ethambutol, Myambutol, pyrazinamide, Zinamide, rifapentine, Prifdin. You must take all of the medication your provider prescribes, or not all of the bacteria will be killed. You will have to take these medications for as long as you're told, sometimes up to 9 months. Some forms of TB have become resistant to medications. It's very important and likely that your provider will use more than one drug to treat TB. It's very important to finish your entire prescription. Complications or side effects of treatment. Some people have side effects from the drugs used to treat TB that may include skin rashes and other reactions, nausea and stomach upset, itchy skin, yellow skin or eyes, jaundice, dark urine. Talk to your provider about any side effects, because some might mean that you're experiencing liver damage.
Thanks for watching. Please like, share, and subscribe for more health tidbits.